Hello, everyone. My name is Ronnie. I'm with three beautiful ladies today. I have Jasmine, Bailey, and Katie. And today we are presenting our self-care study for our adult patient. Our team utilized the SOAP note format, which is the subjective, objective, assessment, and plan. And then Jaslyn will start by introducing our patient.
So for the subjective or the background of our patient, we have Catherine Flynn, who is a 53-year-old female with the chief complaint of teeth sensitivity to hot and cold, with additional concerns regarding gum recession of the lower anterior teeth. She has an allergy to the antibiotic tetracycline, and she also reports being a lifelong resident in an optimally fluoridated community. She experiences anxiety during dental appointments due to the past fainting episodes in anticipation of painful scaling, and expresses concerns of this event reoccurring. The patient's husband also passed away 1 year ago and expresses difficulty coping with his death. The patient has rheumatoid arthritis and takes Voltaren for this and Tylenol. And she also experiences syncope and has agnia pectoralis and is currently taking cardizem, and additionally holds a prescription for nitroglycerin but is not currently taking this medication. She also has a combi patch for hormone therapy used for postmenopausal symptoms, and she was recently hospitalized for shoulder surgery within the past 5 years, and she reports no use of tobacco products.
It's Ronnie again. I'm doing the objective part of our SOAP notes. So I'll just be telling you what data we gathered from our patient and what clinical stuff we saw in the mouth. So we're gonna start with our patient vitals. So our patient has a blood pressure of 103/62, which is a little bit low, but it can be normal for the patient since she's taking the cardizem medication for blood pressure and heart. And then we just asked the patient if that's the normal blood pressure for them. The pulse rate is 72 and the respiration is 18, so those are normal. And then the patient has slight calculus on the lingual surface of the mandibular interiors, and that can be caused by the saliva glands there. And then slight interproximal plaque around the restorations are present. The patient also presented using the scrubbing method of brushing and regular use of floss, rubber tip stimulator, and some fluoride mouth rinse, but the patient did not specify any brands of those. So for intraoral and extraoral examination, we didn't find any significant findings. Probing depths are generalized 2 to 3 millimeters and some localized pocket depths of 4 millimeters on number 4, number 5, number 29, and number 30. Localized 5 millimeter on number 6, and on 8 millimeter pockets on number 30 and 31. So we're gonna move to the gingivas. So I'm gonna share my screen here. So we're moving to the soft tissues. The gingiva is generalized pink and scallop and firm on the anterior maxillary and mandibular. Keep saying okay. And some erythema and ecchymosis, which can a little bit of bruising here on the hard palate and the incisive papilla here that we noticed, and also we noticed some wear facets where the crown or where the 3-unit bridges, number 19 to 21, and that can be caused by bruxism or just the denture hitting on those bridge first. There's some localized extrinsic and intrinsic staining caused by the amalgam restorations. Here you can see the darkness of the tooth, but that's not significant as well. On the chart notes, we also noticed some exposed furcations on number 30 and 31 as well as number 19, but there's no through and through furcations noted. There are also early signs of demineralization on the mandibular canines, and then some gingival recession here on the interiors. of the maxillary or mandibular arch and some of the maxillary arch as well. For mobility, there's class 1 mobility on some tooth, which is the mandibular left and right lateral incisors. And there's also class 1 mobility on the left second molar where the partial denture clasp attaches. So that could be causing it a little bit of movement. We also noted some missing teeth. The tooth numbers missing is number 1, 3, 14, 15, 16, 17, 18, 20, and 32. There is also minor malocclusion noted on number 6 and 27, but that could be caused by the partial denture not being in there. So, and then we're gonna move to the radiographs. Let me just rotate this. Can you guys still see my x-rays? Yeah, okay. Just move this. Okay, so for the x-rays, the radiographs reveal some bone loss on number 30 and 31 here. As you can tell in the x-ray, compared to other bone level, this one's a little deeper. Okay, and then, so for radiolucencies, we notice some radiolucencies on some tooth here. First will be the leaky margins that could be a possible cavity on number 12. Number 12 is right here. Number 12 distal right there. There's some radiolucency there. There's also some on the amalgam filling on number 30, which is the mesial part there. You see the darkness under that filling, and that one too, the mesial and distal portion of it. So we're just gonna have the doctor reevaluate that, diagnose it for us. Also, we're just gonna put some watch on some of the crowns that she has, which is number 13 and 31. This crowns right here. There might be some leaky margins on the distal part of number 31, and then on the mesial part of number 13. And that's my objective. And I'll pass you to Katie for the assessment.
So as we assess the patient's home care, we come to the conclusion that her home care is adequate. She uses floss, fluoride rinse, and a rubber tip stimulator. Oral cancer is low because the patient does not consume alcohol, smoke, or use any tobacco products. Caries risk is high due to xerostomia from medications that she's taking for rheumatoid arthritis. Other factors including existing decay, exposed root surfaces and plications, current demineralization on the facial surfaces of mandibular canines, and many multi-surface existing restorations. Periodontal risk is high due to patient's age, periodontal bone destruction, systemic osteoporosis, stress, and rheumatoid arthritis. And patient states that her goal is to clean better around restorations and to find a way to brush without quickly wearing out her toothbrush. So now on to Bailey.
We decided to split treatment between 2 appointments, with the main goal being to address the patient's chief complaint and improve her overall oral health. The patient already has adequate oral hygiene habits, so for the first appointment, we would continue to encourage good home care by recommending that she brush her teeth at least 2 times a day, once in the morning and once at night, with a toothpaste like Sensodyne that contains stannous fluoride and helps to reduce tooth sensitivity. The patient reported wearing out a toothbrush within weeks, so we'd also instruct her to use less pressure when brushing, especially on the mandibular anterior teeth, where recession is visible and the gingiva is thin. To help facilitate this, we would recommend a toothbrush such as the Oral-B Power Pro 1000, which is an electric toothbrush with a pressure sensor that stops pulsation when too much pressure is applied. If the patient prefers a manual toothbrush, we would recommend the Dr. Collins Perio toothbrush, It has soft bristles and is ideal for patients with sensitivity and gum recession. The patient additionally reported using the scrub method of brushing, so we would suggest an alternative like the Charter's brushing technique that would be especially helpful with her partial denture and recession. Because the patient has a xerostomia risk due to her arthritis medications, age, and hormonal changes, we would recommend she use a mouthwash like biotin as a salivary substitute. Due to present demineralization and the patient's high risk for caries, a topical fluoride application would be recommended. Addressing the tissue irritation from the patient's denture, we would ask the patient to take the denture out at night. And lastly, in addressing her dental anxiety, we would ask if she was interested in any relief options, such as nitrous oxide. For the patient's second appointment, we would want to reevaluate the Charter method taught during the first appointment and modify that as needed. If the patient doesn't have any sensitivity relief from the Sensodyne toothpaste, we would offer an alternative, such as MI paste or Prevident. The areas of demineralization in the mouth would need to be reassessed and another topical application of fluoride offered. If the patient is still struggling to clean around restorations, we would recommend a water pick while keeping in mind her temperature sensitivity and an end-tuft brush. Lastly, we would recommend the patient use a night guard to minimize bruxism.
Okay, thank you guys for listening, and that's our self-case study report. Hope you guys enjoyed it and have a happy summer.